The wife of this person, who lives at Kutupalong Rohingya camp in Ukia, was diagnosed with HIV a year ago. A year later, when he fell ill, the HIV virus was also detected in his body during the laboratory test at Cox's Bazar Shelter Hospital. They have 5 children in their family. He wanted to get them tested too.
I was separated from my wife for a year. After a year, I also went to Kutupalong MSF hospital and got tested, and the bacteria was also detected in my body. Then I was admitted to Cox's Bazar Shodor Hospital. Now I will test my 3 daughters and 2 sons.
Now let's come to another story. 4-year-old baby girl came to Cox's Bazar Shelter Hospital on her father's lap for treatment. After various tests, it was reported from the lab that the organism of AIDS disease was found in his body.
My child has diarrhea, body fever day after day and is suffering from various diseases. MSF took him to the hospital, and if he was tested for HIV, he was referred to Cox's Bazar Shodor Hospital. Now the treatment is going on. The rest is God's will.
According to the information provided by Cox's Bazar Shelter Hospital, the number of HIV virus carriers is increasing day by day. Since 2015, 988 people have been infected with AIDS. Among them, 795 Rohingyas and 193 local residents, 504 women, 368 men, 58 infant girls and 55 infant boys among the victims. 3 of the victims are of the third gender. Hundreds of the infected women are pregnant. So far, 116 people have died of AIDS. Among them, 59 Rohingyas and 57 local people. 2 local people died of AIDS in July. The number of people in Cox's Bazar Shelter Hospital lab for HIV test is increasing every day. In the last 1 year, 8 samples have been collected from the bodies of 1,342 people. Doctors say that the rate of AIDS is higher this year than last year.
Whenever we increase the rate of testing from June 2022, we tested about 1,342 people, out of which 129 people were found to have AIDS. So it can be said that the rate of infection is increasing a lot of compared to last year, most of which are Rohingya population. Out of 129 people, 119 are Rohingyas and the remaining 10 are locals. Out of 129 infected people, 16 died last year due to AIDS.
Meanwhile, the Office of the Refugee Relief and Repatriation Commissioner is working with the Rohingyas, is concerned about the increase in the number of AIDS cases. The organization's medical coordinator said many of the Rohingya carry the HIV virus, so that the risk among the locals is increasing.
The prevalence of AIDS among the Rohingyas is slightly higher, as their health knowledge is low and polygamy is prevalent among them. It's spreading more. However, the concern is about the local near the camp. Therefore, the local people should be careful not to have any association with the Rohingyas and any type of marital relationship.
In July, 17 Rohingyas were infected with AIDS. The number of women and children among the victims is 11. Among them, the number of pregnant women is 3. Momtahina Mahi, TTN, Cox's Bazar.